Not much. I mean,
Okay.
I was just trying to, believing that this
Okay.
is gonna go with the days,
Okay. Okay.
waiting for it goes naturally, but
Mm-hmm.
obviously it didn't go.
Mm-hmm.
So I really didn't do much to
Okay.
just compensate or help myself with another activities or some.
Okay. Well, if it's possible and if you're up to it, I don't want to, put any type of pressure on you, but I wanted to ask you, like, what are some things that you actually tap into for self care? What are some things you'll say, well, I put this on the back burner long enough. I need to get to this because this is what makes me happy. This is what makes me feel good inside. And this is something that I miss doing. What are some of those things you would
Sure.
say?
Well, one of the things that I always enjoy when I was younger was sports.
Okay,
I was a very sporty young man
that's awesome.
until the day when I became a dad.
Okay,
But the thing is that I became not only a dad but a single dad,
okay.
and then a dad of a special ed
Mm-hmm.
or special needs
Mm-hmm.
kids, and that make
Mm-hmm.
me my time more absorbed and busy, and so I have to just give up
Okay,
my own preferences on getting relaxed on my own side and stuff. Doing exercises was
mm-hmm.
one of them,
Mm-hmm.
practicing sports, then going out for
Okay,
movies or having friends. All
okay.
these things that I used to do
Mm-hmm.
was practically gone in the last 18, 19 years.
Okay. Do you think there's a way that, not saying all of it, because sometimes in life you have to take baby steps to get to the places you want to be, or things that you want to go back and say, I really enjoyed doing this. Is there any type of way or anything, any type of steps you have taken, whether it's in the recent days, weeks, or months, to say, I really want to try this again, and you actually initiated to try that again?
Well, yeah, I believe now that we
Mm-hmm.
are talking,
Mm-hmm.
probably I will try.
Okay.
Now is this is gonna take me double effort for the
Okay.
way that I am thinking, and also the level of difficulty will be that the people that used to meet probably is gone.
Okay.
So I will need to build new um,
So.
network of
Okay.
friendship, with new people,
Okay.
because the people they travel, they move,
Absolutely.
you know. So
Is there? Have you actually sit down to like say, well, I'm put this on my bucket list. Maybe it's someone at the job, at your place of employment. Maybe it's someone at your church, or someone that you say, well, I've given conversation with this person and I feel comfortable with speaking to this person. So is that, do you have a go-to person or someone you say, well, I can just say, offer them a night out
right.
or a day out, say, hey,
Hmm.
I would really love for us to continue conversation, and I really enjoyed speaking with you. Is there a person you have in mind to do that with?
Well, at this time of life, with this age, you
Mm-hmm.
know that everybody has a sentimental partner, or
Okay.
somebody has a person who is, the significant one.
Okay.
So it's very difficult to find a person who you can say,
Mm-hmm.
well, we're going to go out and we're going to have a coffee after hours, because everybody has to, go back to their homes. And also, probably, I lost this touch to
Mm-hmm.
invite people out, or,
Mm-hmm.
uh, you know, getting into that, because again I was so focused in taking
Mm-hmm.
care of my kid.
Okay.
Then now, and frankly speaking, I haven't think about that, but probably now that you mentioned, probably this is something that I would
Okay.
do.
Okay.
Okay, I can give it a try.
Absolutely.
Yes, and thank you for the
Absolutely.
hint.
Oh, absolutely. You know, positive encouragements, positive affirmations about
Yeah.
ourselves. Sometimes it takes time to get to those, those train of thoughts to think positive in a positive way. And so I really want to do. Um, it's actually it's cognitive behavioral therapy.
Okay.
I want to introduce this to you and see if I know we spoke about different techniques like maybe meditation. Again, maybe doing something that you have put on the back burner and you haven't been able to get to doing it. So I want to just go over like the cognitive behavioral distortions. So some of these things on this list, I want you to kind of take a look at and see if this is how you're feeling, how your thoughts are, and how you are emotionally distressed too. So, is there anything on this list that you can identify with that is making you, that's, in it's basically getting you to the point to where you feel like, hey, I'm feeling like this, but I don't know what to do about this.
Mm-hmm. Mm-hmm. Probably the all or nothing thinking,
Okay,
because I am in the very beginning of this, and probably
okay,
I am still seeing things black and white.
okay,
So I cannot see
okay,
colors here, and probably this is the most that it does identify with the way that I am feeling.
okay. Well, I want to say that with cognitive behavior therapy, it introduces positive ways to think. So it kind of turns those negative thoughts and influences positive behaviors. So whenever sometimes our brains, they're we're all designed in a different way. We're
Okay.
all created in a different way. And sometimes we're going to have negative thoughts. Sometimes our brain is not going to be our best friend. However, whenever you have those thoughts, come back to your techniques. Even if it's something that you have to write down on a planner, or you say, in this checklist, I'm going to give this to you. Because whenever you feel like this, sometimes you can do an exercise and say, well, let me write this down and let me check off how I'm feeling. So, how can I replace this feeling, this negative feeling, with a positive thought? So that's what the cognitive behavior therapy introduces. So depending on the level of of the way that you think or how you feel, you'll just relate to this list and say, okay, this is where I'm at. So now let me try to replace that and think in a different way for a different outcome. So how does that sound to you?
Yeah, it makes a lot of sense to me.
Okay.
Sure.
Okay. So these interventions, they're really great to have to really just give you an overall sensation of, hey, it's possible to have a positive way to feel, to interact. And I want to, encourage hope. I want to help you to see that there's a sense of hope. And sometimes it takes time to get to that hope. But I know cognitive behavioral therapy is a therapy that's letting you know that you're not alone in this journey. And it's really going to help you through, providing you with the techniques that you need to get through your day. Sometimes your day is not going to be 80%. Sometimes it's difficult to bring the best versions of ourselves to the table. And sometimes we just want to roll over. But you will always have something to go back to and say, well, you know what? That technique actually worked. So let me try that again. So would this be an exercise that you would love to try, just to incorporate in a daily atmosphere?
Yeah, maybe. I
Okay.
don't know. I
Okay.
hope.
Okay. Okay. Okay, so I just want to know that everything is, at this point you say that everything is going great, and we want to kind of keep on that path if possible. And if you sometimes we have situations to where it's not going to always be so good. We have setbacks, but sometimes setbacks can gear you up to a major comeback. how are you going to get to that major comeback? So cognitive behavior therapy and other skills are in place for you to get to your comeback. So I would love to know and see how you're going to progress within this next week.
Okay.
So when we meet for our next session,
Okay.
I want to see one or two things that you picked positive out of the cognitive behavioral therapy exercise.
Okay.
And we can kind of relate from there.
All right.
Thank you for coming.
Thank you, ma'am.